Hi.
Hi.
Thank you so much for doing this. I really appreciate it.
Oh, of course.
Okay, so it's gonna be really quick. It's just a couple questions.
Okay.
Shouldn't take long at all.
Okay.
So first thing is, can you just tell me about yourself?
Yeah, so my name's Nikki. I'm currently working as a family nurse practitioner at a primary care office. I started my career with nursing and everything, going to Youngstown State University after I graduated high school in 2012, and I graduated with my BSN from there in 2016. And then I worked on a med-surg unit for about 6 years, and then graduated from Youngstown State again with my graduate degree and started working at the office I'm working at now in October. So
Perfect. Perfect. All right. Well, you answered question number 2, what your APRN position was. So we'll go right to question number 3. Do you see an influence of advanced practice nurses in today's healthcare system? If so, how? And if not, why not?
Yes, I definitely see an influence with them. I think advanced practice nurses are so valuable because you start off as a nurse. And I know some people go straight from nursing school to advanced practice school, but just even having that background, working with patients, I just think that nurses work a lot more closely with patients. And, it was taught to me in nursing school that doctors treat the disease, but nurses treat the patients. And
Right.
I think that really speaks to advanced practice nursing, where you learn more about the diseases, but you're still really treating the patient themselves.
All right, perfect. Next question. What are some barriers APRNs face?
So, kind of like what I just said, going off of that, doctors treat the disease, nurses treat the patients. You really have to find that growth when you go from being but being a bedside nurse to being an advanced practice nurse, to more focus on the disease because that's what you're doing.
Right.
So you have to find that balance where you are treating the patient, but also taking your knowledge to the next level and everything. So that's definitely one of the barriers. And then 2 other big ones that I see in my practice are non-compliance of the patients themselves. That makes your job really challenging and frustrating. And the big one, insurance.
Right. Do you run into a lot of problems with that? With insurance?
Fortunately, not too many with insurance itself. It is just a big hassle not being able to get patients certain medications that they need, sometimes that they have already had, and you still have to do, insurance authorizations or things like that. And so things just don't really get done in timely manners.
Right. Do you ever have any problems with the patients being upset that they're seeing a nurse practitioner instead of a physician?
Yes.
Yeah.
Not all the time.
Okay.
Some people do say, they'd rather see the doctor and everything, and that's absolutely fine. We don't, argue with them. They're allowed to do what they want. But a lot of the times, just because of my age, I'm only 28, so they always say you look too young to be a doctor. So that's the comment that I get a lot, and then I just kindly explain that I'm not a doctor.
Right.
But I can still help them and move forward with their treatment. Okay,
perfect. And then last question is, what changes would you like to see made for advanced practicing nurses?
That's a tricky one, but I guess kind of going back to the whole doctors versus nurse practitioners, being an advanced nurse and everything is definitely scary. You're really going from this role where you're taking orders from a doctor to writing your own orders.
Right.
So I think more, clinical practice, and it's really truly school dependent and your preceptors and everything too. But I just think more clinical practice is valuable. And I work with a lot of physician assistants who had more like clinical application practice.
Yeah.
And, so I can just see the difference sometimes in their confidence versus mine, because like I said, it is very challenging going from being that bedside nurse to asking the doctor for orders to now writing your own orders.
Absolutely. Absolutely.
I think that would, the more confidence you have as a provider and the more experience you have, I think that would alleviate some of the patient's fears of being treated and seen by a nurse practitioner. So.
Oh, okay, perfect. Well, that is all the questions that we had for you. So, like I said, it was going to be really quick, and I really appreciate it. You really helped me out.
Yeah, no problem.
All right. Well, thank you. Enjoy the rest of your day.
Yeah, good luck in your studies and everything, and take care.
Thank you so much.
Bye-bye.
Bye.